At that time, we also announced that we would be eliminating 60 clinical and non-clinical positions, and the changes that you see in the ED are part of that. Let me say that these are good people. These are hardworking people, people who have done a good job of taking care of the community. However, what we have to do ultimately is make sure that we're providing the best care possible to our patients. And so when we look at the LPN position, by rule of state law, as dictated by the licenses that LPNs receive from the state, there are certain things that LPNs are allowed to do. And by license, there are other things that a registered nurse, an RN, is allowed to do. For example, an RN can assess a patient and make recommendations on the patient's condition, where an LPN, for example, is able to watch a patient while being supervised by an RN or somebody of that nature. So in this particular instance, given the fluid nature of what's happening in the ED, given the conditions are often changing from minute to minute, we decided that in the best interest of patient care, it was very important that we shift to a higher level of care and to a level of care that was had a higher accreditation from the state, and that ultimately gave our patients in that situation enhanced care.
Michael Bernstein is with us from Summa Health System. Michael, with that being said, and the difference between the LPN and the RN as far as duties, I imagine the RN comes with a higher salary. Is that correct?
Well, I wouldn't know the specific salaries, but I can tell you that an RN salary is higher than an LPN salary, and that at the same time, with that, an RN's level of education is higher. So an RN is required to go to school. There's a higher level of training, and the degrees that they would achieve are higher, so with that comes a higher compensation.
So I guess what I was getting to with the termination of some of these LPN contracts, is this necessarily a cost savings then?
This is not about money.
Yeah,
this is not about a cost savings. What this ultimately comes down to is the level of care. At Summa Health System, we believe that the patient and the care that the patient receives is absolutely the most important thing that we do. And so when we have an opportunity to bring in a registered nurse who can provide a little bit higher level of care in an environment that is constantly changing, we believe that's in the best interest of the patient. So what I can tell you is that we are actually replacing the LPN positions with registered nurses, and we are currently in the process of hiring nurses to replace the LPN. So no, we would not compromise patient care ever to save money. What we want to do is make sure that we're staffed appropriately, and that we have the right people in place to provide the right level of care that's necessary in that particular unit.
Yeah, you and I are on the same page, because that's where I was going with my follow-up question, so you knew where I was going, is that are you going to hire then additional RNs to take some of these roles if this is indeed an improvement of your health care?
Yeah, we currently have, Ray, positions open in the ED for registered nurses. We're trying to fill 9.5 FTE positions right now. 5 of those positions are directly related to the decision that we made yesterday to eliminate those LPN positions. So we are currently and looking in the immediate future to bring registered nurses in to replace those people. And in the interim, we'll staff appropriately and make sure we have the right coverage in the ED, but we absolutely are looking to replace these people full-time.
Michael, it's never easy to say goodbye to family members, these LPNs. Did they know this was coming? And my follow-up, is Summa going to do something to maybe help keep some work coming their way?
What I can tell you is that we did, again, make it clear that there would be 60 positions eliminated.
Okay.
We did not tell them ahead of time. They were informed over the weekend that we wanted to have a meeting with them, and we gave them a few days to prepare for that meeting, and then we had that discussion yesterday. It is not easy to do something like this, and this is always something you want to do as a last resort. We know that this has an impact on these people, and we know that it has an impact on their families. And again, these are good people, people who work hard, and people who have come to work every day to care for others and to help make them better. And we respect that, and we're appreciative of it. At the end of the day, this really does come back to patient care, again, about an enhanced level of care that we have to provide to people in the emergency department that we believe must be filled at the RN level. So good people. We appreciate everything that they've done. Never want to have to do something like this. We will help everybody with the severance package. We will provide outplacement services, and there are lots right now, probably more than 200 jobs that are open at Summa Health System today.